Hi, good wishes to everyone. I am Dr. Rajendra Prasad, Senior Consultant Vascular Endovascular Surgery, Manipal Hospital Yeshwanthpur. So, we are celebrating August 6th as the National Awareness Day or National Vascular Disease Awareness Day. On this auspicious day, Vascular Society of India was formed in 1994. So, on this occasion, I would like to share some of my knowledge to create awareness among the public and also with my colleagues. So, first I would like to tell about what is a vascular surgeon and also what he does. So, a vascular surgeon who does surgeries of the blood vessels of all over the body except the brain and also of the heart. So, he will take care of both medical and surgical conditions of the blood vessels. So, another speciality of a vascular surgeon is he can do both endovascular procedures, that is angioplasty, stenting and also bypasses. So, that bypasses can be with a PTFE graft or also can be with a vein. And then a speciality, a vascular surgery speciality is a new kid on the block, I can say like that, because it's a newer speciality. We got our super speciality started just from 1990s with fellowships we started, and also after that we got the first DNB seats in Karnataka in 2007. So after that we got first MCH in 2011. So with this introduction I would like to tell about how does a vascular patient comes to us. A vascular disease patient usually comes to us with a non-healing ulcer or gangrene in the foot to the patient. Then what would be the cause of these blood vessels or vascular diseases? So most common disease which causes a blood vessel disease is called as a diabetes mellitus, we all know. So it affects all the blood vessels of the body. It can start from the eye and then it can go till the toes. So other important thing along with diabetes is smoking. It's a lifestyle disease which can be definitely controlled, and also if the patient stops smoking, he can definitely prevent his disease of the blood vessels. And also another important thing what we cannot really prevent is age and also atherosclerosis. Atherosclerosis is the disease of the ages, but because of the lifestyle we are getting the early atherosclerotic changes in all our blood vessels. So a patient who comes to us with a pain in the leg and with a non-healing ulcer, we have to supposed to diagnose it early, and then we need to save his limb. In turn we can save his life. So a vascular disease is most dreaded disease in the body. So it is most difficult to treat rather than even sometimes many of the malignancies. Patient can die compared to many of the malignancies before any of the malignancies can kill a patient. So another important spectrum of the disease is a varicose veins. So varicose veins are the dilated and bulging veins in the leg, and also patient can have pain and then swelling in the legs, and then sometimes bleeding with color changes. So in our center we have got all the latest treatment modalities like laser, radiofrequency ablation and also glue injections for the best outcome of the patient. Couple of more diseases and then its treatment I will just briefly explain. Something like an bulging of the arteries, that is called as aneurysm, which is sometimes it is so deadly the patient may not reach the hospital. In aortic aneurysm, if it ruptures, more than 9% of the patients will not really reach the hospital, and then saving them will be very difficult. So for these patients, early diagnosis or something like a screening program is being held in our hospital and then can be utilized for the screening of the aortic aneurysms. So another dreaded disease is called stroke. Stroke can be prevented with surgeries called as stroke prevention surgeries, carotid endarterectomy, that is carotid artery surgery, and also carotid angioplasty, stenting. And then most of the patients they are getting, because of the long standing diabetes, their kidneys are getting failed, and also they are getting dependent on the dialysis. For this dialysis purpose we create an access called as AV fistula or AV graft and also permanent catheters. And then complications of this AV fistula and graft also being managed with us. And then another medical cause of clots in the veins is called as deep vein thrombosis. A deep vein thrombosis there can be many causes, and also it can become deadly, and then it is the second cause of death inside the hospital, because these clots can definitely travel into the lungs and then patient may die before reaching the hospital. With this opportunity I would like to share this knowledge to the people and also general public and also colleagues to create awareness among the general public to come to the hospital with their problems at the earliest and then get treated fast, so that we can save limbs, in turn many lives. So our motto is to make the patient walk on their own limbs. So save limbs, save lives. Thank you.